My name is Alex G, and I will be presenting the effects of high-intensity exercise training on fat loss and fasting insulin levels of young women. This original article is written by E. G. Trapp, D. J. Chisholm, J. Friend, and S. H. Bouchier. Introduction. Obesity levels are escalating worldwide. This is in both developed and in developing countries. As we know, obesity is linked to poor health and reduced quality of life. This includes heart disease and other quality of life diminishing diseases such as diabetes. This has led to a push to develop effective weight loss and weight management strategies. Now, typically, caloric restriction is the main weight loss strategy. This means that if somebody was to follow a 2,000 calorie a day diet, they would actually aim to eat less than 2,000 calories per day in hopes that over time this would help them lose weight. This need for weight management has driven exercise programs to be designed for fat loss, resulting in increased cardiorespiratory fitness and a preservation of fat-free mass. Now, most weight loss programs that are available for weight loss are what we call steady-state exercise programs, meaning that the patient, the participant, works at about the same exertion level for about 30 minutes a day for 4 to 7 days a week. Now, this can vary. Some people will work for an hour, 45 minutes, up to 2 to 3 hours even. These programs typically lead to little or no fat loss by themselves. What this means is that to really see results through these programs, typically a diet component is needed. So a combination of calorie restriction along with exercise programs. The goal of this article was to determine if a high-intensity intermittent exercise program would have a greater effect on fat loss and insulin resistance in people who are already obese. Now, what is high-intensity intermittent exercise? High-intensity intermittent exercise is made up of brief high-intensity anaerobic exercise followed by brief bouts of very low-intensity aerobic exercise. So this is to say that for 20 seconds somebody's working as hard as they can and their muscles actually aren't using oxygen to perform the work, followed by, let's say, 40 seconds of low-intensity aerobic work which actually uses oxygen and the muscles to perform the work. High-intensity intermittent exercise has already been proven to enhance the capacity for fat oxidation. The subjects. Subjects were non-smoking and inactive women between the ages of 18 and 30 years old. Now, this is a fairly young age group. These women were considered adults, but to be a better sample, it would actually be better to include an age group of 18 to 50 or 60 years old, or to do another test of 30 to 50-year-olds, just to determine how effective this regimen actually is. Now, the subjects were randomly selected into one of three groups: the high-intensity interval exercise group, the steady-state exercise group, and a control group. Prior to testing, subjects were screened using the PAR-Q. Now, the PAR-Q is a pre-exercise questionnaire. This is very standard at most gyms. Most gyms and fitness programs will require you to fill this out. Now, this is so that your trainer or your fitness instructor will know exactly what you can and can't do. It will help them to develop a program and a protocol for you, but it also informs them of any health issues you may have, such as heart disease or elevated blood pressure. That way they do not put you in at-risk environment. Now, once these three groups were selected out, it was determined that the age and BMI differences were similar for all three groups. That means that the mean age and the mean BMI for each group was relatively close. It may not have been exact, but it was close enough for the study. Now, the pre-test procedures. All subjects underwent blood and VO2 peak testing prior to the study. The blood was actually frozen after part of it had been taken to test for lactate, glucose, and blood lipid levels. The VO2 peak test was taken to determine the participants' current aerobic and anaerobic work capacity. Now, the VO2 peak test was a ramp assessment that began with a 3-minute warm-up, followed by 2-minute stages. Subjects began cycling at 30 watts with a consistent speed of 90 rate per minute. Every 2 minutes, the workloads were increased by 15 watts until a VO2 peak, which is the volitional exhaustion, was reached. Now, the heart rate was taken at the end of each stage. This is actually to determine when exactly the subject is ready to go on to the next stage, but also when their heart rate has reached, or when the participant has reached their VO2 peak. Body composition. There are several ways that we can assess body composition. For this study, they were very lucky in the fact that they got to use a DEXA scan. Now, each participant underwent a dual energy X-ray absorptiometry, or DEXA scan. This is the best way to assess where body fat is located and how much body fat there actually is compared to lean mass. Now, the DEXA scan can tell the total body, central abdominal fat, lean tissue mass, and a percentage of the total tissue were measured for this, using this. DEXA has already been validated as a measure of body fat percentage, and central abdominal fat measurement by DEXA has been shown to correlate strongly with insulin resistance. Diet. This seems like it may be a small part, especially since we know that diet is typically a major role in weight loss, but these participants were actually asked to keep their normal eating patterns throughout the training program. The subjects were asked to provide a 3-day diet journal on their first and final visits to assess how their eating patterns may or may not have changed. The high-intensity intermittent exercise protocol. For this protocol, subjects would perform 8 seconds of sprinting and 12 seconds of slow pedaling for a maximum of 60 repeats a session. The participants would begin by warming up for 5 minutes and then follow a tape with a start and stop cue. This way they didn't have to worry about or think about anything. All participants started with a resistance of 0.5 kilograms. Now, the subject started with as little as 5 minutes of work per session and gradually increased work time to a maximum of 20 minutes per session. Once reaching 20 minutes of intermittent sprinting at 0.5 kilograms resistance, per session, the resistance would be increased by increments of 0.5 kilograms. This means that if the participant started at 0.5 kilograms, once they were able to complete a 20-minute session of high-intensity intermittent exercise, they would then go up to 1 kilogram resistance the next session they came in. At the completion of each session, participants performed a 5-minute cool-down with standard quad, hamstring, and calf stretching. Steady state exercise protocol. Subjects performed a 5-minute warm-up at a comfortable workload. They got to choose this workload. The participants would then exercise at 60% of their VO2 peak for 15 to 20 minutes. Their duration was gradually increased to a maximum of 40 minutes per session. Now, their resistance was increased by 0.5 kilograms when there was a decrease in their heart rate. A decrease in their heart rate indicates that their body has begun to accommodate the load that is being placed on it and is adapting to better perform. At the end of each session, each participant completed a 5-minute cool down, along with the same quadriceps, hamstring, and calf stretches as the high-intensity interval exercise protocol. Now the control group. This group had it the easiest. They were just asked to maintain their current physical and dietary habits for 15 weeks. They were asked to supply a record of their dietary intake at week 1 and 15. Blood tests. The blood tests are important because we use those to test insulin levels and insulin sensitivity. These were tested prior to and after completion of the exercise protocols. Adiponectin and leptin were also tested pre and post regimen. These are just other factors that can indicate a body's adaptation to exercise and weight loss. Exercise heart rates. The high-intensity interval exercise group recorded a significantly higher mean training heart rate than the steady-state exercise group. High intensity had a mean training heart rate of 168.6 beats per minute. Steady-state exercise had a mean training heart rate of 155.7 beats per minute. This just means that the high-intensity exercise group was working harder throughout their sessions than the steady-state group. Peak aerobic power. Both the high-intensity interval group and the steady-state group achieved a significant increase in peak absolute oxygen uptake. High intensity achieved a VO2 peak increase of 23.8%. Steady state achieved a VO2 peak increase of 19.3%. This just goes to show that their bodies were beginning to accommodate the workload that has been placed on them over time. Total mass and body fat. The high-intensity group lost about 2.5 kilograms of fat mass. You can see this on the chart. They are the blue graph that is actually under the zero. This is a positive movement. The steady-state group and the control group actually gained fat mass throughout the test. Central abdominal fat. Once again, the high-intensity group led to a significant decrease in central abdominal fat of 0.15 kilograms, negative 0.15 kilograms. Once again, this can be seen as the blue graph on the picture shown. The steady-state and control group had minimal amounts of increases into their central abdominal fat. This correlates to the fat mass that they actually put on throughout the trial. Fasting insulin and glucose. The high-intensity interval group decreased fasting insulin by 31%. The steady-state group decreased fasting insulin by only 9%. There is a significant correlation between central abdominal fat loss and change in insulin concentration. The fasting glucose concentrations did not change throughout the test. High-intensity interval exercise and steady-state groups both increased their cardiovascular fitness. This is seen throughout the test by the increase in peak VO2. Now, the high-intensity interval exercise group was the only group with a significant reduction in total body mass, fat mass, and fasting insulin levels. This goes to prove that high-intensity interval exercise may be the best way to help obese individuals lose weight and keep that weight off. This is in part because they only worked out for 20 minutes at a time, which takes away the no time example, but it also is a smaller time commitment. But once again, the high intensity interval exercise group was the significant improvement in total body fat mass, VO2 peak, fat mass, and fasting insulin levels of these two in this review.